cited, the question, what does engaging with patients really mean? So let me ask you, you've all been patients, haven't you? And for you, if you think back to the number of times you've been patients, what's it been like when a health professional has truly engaged with you? What did they do specifically? And in contrast, when you had a bad experience, what was going on there? So as I go through, and I will keep the 8 minutes, I promise. As I go through this, I'm going to go through this really quickly because there's so much I want to say to you, is just hold those two little films, if you like. One of the good engagement and one of the really poor engagement. And just ask yourself constantly, what's the difference that makes the difference? So why am I here today? And the theme of this conference is all about leadership. I'm here in front of you today because the consultant stroke physician, Dr. David Collis at Watford General, is a very visionary leader, and he spotted an opportunity. And because I was such a great recovery, he actually approached me. He said, David, you're one of the best recoveries we've ever seen. We'd like to learn from you. And the two things that we feel that we can learn from you, one is what are the particular strategies that enabled you to deal with such devastating stroke where you lost half the movement in your body? And how did you have the resilience to drive and support your recovery? We'd like to know that so we can take those strategies and give them to other patients who are far less resourceful than you, and to deal with that critical 2-week period after a stroke so they will engage with their rehabilitation. And secondly, what we'd like to do as a medical team is to understand better what great recovery looks like through a patient's eyes, so we can constantly reflect as to what we need to do differently in order to support the recovery process overall. So if I ask you to go back to what your great experiences are, what I'm going to tell you, you'll know. You'll go, yeah, David, I get that. Yeah, they listened to me. They anticipated my needs. They said all the right things. I felt cared for. I felt better. Yeah, would that be fair? Yeah. But where it gets interesting, if I put on the glasses or the lens of a communication specialist, what I want to know specifically is, what's the difference that make the difference? What is it that people did that made such a great impact on my recovery? So if I take some examples, and there were many of them in David Collis's team, was the consultant cardiologist, Will Wallace. So when he walked into the room, and there's a great leadership thing, when he walked into the room, he didn't say anything. But yet his pure stance, the way he stood, gave me confidence. And in my head, I said, this man knows his stuff. And then he opened his mouth and he looked at me, and it's almost like he anticipated all my questions. It was quite spooky, really. He said, I know you've got a lot of questions. When, what, how? He said, but David, let me reassure you. He said, you're a young, fit man. Thank you. And there's a great chance of recovery. So just disconnect yourself from the world for 3 months and just concentrate on getting better. And he answered a huge question for me, which is how long, when, how, what was going to happen? And I kept asking this, didn't get many answers. He answered that question for me. So from your point of view as health professionals, framing, I cannot emphasize how important framing is. That anxiety, the question, how, what, when, is the language that you use has such a profound impact on the patient. And I actually called it the language of recovery. In contrast to language which is used, which can be so toxic, that can cause so much anxiety that make the patient feel even worse. Does that make sense to you? Yeah. So I'll give you another tiny scenario, and then I'll move on because I'm conscious of time. So when I had my first consultation with my neurophysiotherapist, Jeanette Gibson. And just to give you a picture of how I was, so I couldn't stand. I was in a chair, my fist, my right hand was just a fist, and my arm was hanging like this. Okay, so that's how I was. And again, had this huge anxiety of how long when. And again, she anticipated that so elegantly. And she looked at me and she said, David, she said, the first 2 weeks are critical. A lot of movement can come back within that time. So we're going to work with you to really support you during that time to get as much movement back. And the first thing she did, she said, I want you to notice the language, take your affected hand, not paralyzed, affected hand. Take your affected hand and your other hand, not good hand, your other hand, and open and close your left hand and visualize your right hand opening. So of course, my arms is like this and my fist is like this, and I'm going to be, yeah, right. So I held it like this, and I'm doing this, and she picked up immediately this quizzical look on my face, and she said, David, I know nothing is happening yet. I know nothing is happening yet. But as you do this, a lot of activity will be going on within your brain as it attempts to reroute the neural pathways. And that beautiful use of yet, so the presupposition that stuff was going to happen, and she was right. Now you might say medically, okay, well it could have been the other way, but my fingers did, over the days, began to flicker, and then after 2 weeks I was able to open my hand completely. Okay, so just give you the sense of how powerful language is and how you phrase it. So in the number of talks I've given about this, one at the King's Fund, one at the University of Oxford, someone always puts their hand up and says, David, is this nature or nurture? Is this something natural that people just do instinctively, or can it be trained and coached? And my answer is yes to both. And I think, from a communication specialist point of view, the two things that are so key about what makes the difference in terms of a health professional truly engaging with the patient is not time. And I know there is so much pressure on you, and there are so many demands on you. Is that right? Do you kind of feel there's just so much, there's not enough time? Would you say that? Would that be your world? There's not enough time? But I think it's focus. I really do. I think it's the state. If we go back to my consultant cardiologist, it's the state, your state, and by that I mean the energy in your body, how you hold yourself, your physiology, what's running inside your head, your internal dialogue, how you present yourself in the room to the patient is what makes the most impact. It really does. And there are two dialogues, aren't there? There's one that's going on in your head, which what questions you're asking, and the other dialogue is the actual spoken dialogue. And when those are in sync, that is when you get the most profound impact on the patient. And the other, of course, and you'll know this, is being able to step into the shoes of the patient. Yeah? To be able to connect with the patient's world, to imagine what it's like sitting in their chair. So I think those are the two key components. So what I'd like to invite you to do, and I'm sure you do it, is how can you do that better? How can you ask better questions when you go into the patient's room in order to get into the best possible state? Does that make sense? Yeah? Okay, so a couple of practical things, and then I'll stand down. So one is, do any of you here meditate? Just a few of you, okay. And the rest of you kind of, does this sound a bit woo-woo? Is this a bit woo-woo? No, it's not woo-woo. There is massive amount of evidence-based stuff. You can read articles in Scientific American about the impact of meditation. Have you all got 5 minutes in the morning and 5 minutes in the evening? Yeah, everybody? Okay, make a note of this. Headspace.com. Headspace.com. It's an app, and the Chief Medical Officer, Dr. David Cox, when he was giving a keynote on this, said that one of the most profound things about meditation is to enhance your listening skills. To enhance your listening skills. So if you, and also your complete, your well-being, all that overwhelm that you have currently, will just help clear your own personal space and reinforce your own well-being. The other thing I would really encourage you to do is to buy one of these. Go to Ryman's or Smith's and keep a journal. This was probably a lifeline for me as a patient. Is what I did is that I would note down all the good stuff. So again, back to being half paralyzed, I had a choice. I could just get really angry and frustrated with how I was, or I could focus on what I still had and what I could be grateful for. Does that make sense? Okay, so if you note between two and 5 good things a day that happen to you, between 2 and 5 good things, what it'll do is profoundly improve your mood. So all that stuff, all that sort of noise that goes on because of the overwhelm, it will really, really help you. And it can also help you with your frustration. You can just vent to the journal. And if those of you are at all skeptical, look at the work of Professor Martin Seligman on journaling. It has a profound effect on your physiology. In fact, he did a trial with AIDS patients where their immunity level went up through actually journaling. So I hope that's been helpful. Thank you so much for listening.